Hello, everybody, and welcome to this edition of the Taking Control of Your Diabetes podcast. I am one of your hosts, Dr. Jeremy Pettis, joined as always by my good friend and colleague,
Dr. Steve Edelman.
If you're just tuning in, Steve and I were both diagnosed with type 1 diabetes when we were 15. We're both adult endocrinologists, and Steve founded the organization Taking Control of Your Diabetes almost 30 years ago. So today is a very special episode. We'll get into introducing our special guest. But it says, when it comes to diabetes, this mother knows best. So, Steve, give a little background on Emily, Dr. King, and then we'll go from there.
Yeah, I'll do a short intro because we want to hear from Emily about Emily. But Emily is a pediatric endocrinologist who developed type 1 when she was 8 years old. And she has 4 children. One of them has type 1 diabetes. Another one has positive antibodies that we're going to talk about screening for type 1. And she has 2 that do not have antibodies, 2 boys, 2 girls. And she's going to tell us about her story, everything from her diabetes to her son's screening, the crazy life she must have.
Yeah, so thanks for joining us, Emily. So like Steve said, there's so much to talk about here, right? Your own story with type 1 diabetes, you getting into medicine, you having 4 children, that's enough right there. But one getting diagnosed with type 1, screening, all of that. So let's start with you, though. So tell us, if you want, kind of your story with type 1, if your experience, et cetera, and then how that kind of maybe drove you into medicine.
Yeah, thanks for having me. So I was diagnosed, as you said, when I was 8, so 1991. And my parents didn't know anyone with diabetes, type 1. Back then it was called juvenile diabetes. And I was diagnosed when I went to the pediatrician's office for a well-child checkup. I did definitely have symptoms. I had lost 18 pounds, was drinking a lot of water and urinating a lot. But my parents didn't know to think anything of it. So the pediatrician diagnosed me, and then I was in the hospital at Vanderbilt Children's Hospital. I'm from Nashville, Tennessee. So I was there for a little less than a week, and then went home and was on 2 shots a day, 4 finger sticks, a very set regimen. And I did pretty well during my childhood with diabetes, although with that regimen, it's a very crude regimen, so it's difficult to achieve target blood sugar levels. And then I chose my path in medicine, mainly because I thought that being a doctor would be a fun job, to be able to help people, to learn a lot of things, and it just seemed like a really exciting career path. I didn't think that I wanted to do pediatric endocrinology because the training was so long, but when I was in medical school, I was able to go to diabetes camp as a medical volunteer, and I just loved it and felt like I was in my element there. And so I just thought this would be really fun to get to work with other families who are affected by type 1 diabetes. Also, the other conditions that endocrinologists treat are really fascinating to me. We see a lot of common things, and then as well as more obscure conditions. And also, pediatric endocrinologists in general are just really nice and really smart people. So I have a lot of them are my best friends. So, it's a really interesting profession. And
you have to be one of the most empathetic doctors out there, dealing with not only the patient with type 1, but also the parents, because you play that role as well, too. And I've heard from my pediatric endo friends that dealing with the kids are great, dealing with the parents is sometimes pretty tough.
Yeah, no, absolutely. It's also one of the most rewarding parts about it is you get to partner with the parents in taking care of children, because children, they're resilient, but they're also vulnerable and voiceless as a population. And so you get to, take on that, be a part of a team with the parents. But yeah, it is very challenging because you're dealing with a lot of family dynamics for sure.
I was going to say your story and mine are actually very similar. So you were 8, but I was 15, but I was diagnosed in 94 or something like that. So it was around the same time.
You show that picture of you when you were 8,
when I was 8,
you tell people you're 15.
Well, I was a weird looking 15-year-old. But I was a cute 8-year-old.
I'm sure you were fine at 15.
But yeah, 2 shots a day, regular and NPH. I had a 1-touch basic. And then I'd say the key difference is that I went into adult endocrinology and you went into pediatrics. So, it's it's fairly uncommon for me to diagnose people with type 1. It definitely happens, but I generally see them after they've been living with it for a while. But it's obviously a big part of what you do. You're right there when, people are first diagnosed, and, educating the child and the family and all that must be a lot.
Yes, definitely. Yeah. It is a lot. And it's a huge, it just turns people's worlds upside down when they're diagnosed, for the kids and the family. And it's just, your heart just breaks for them because it's life changing.
I want to bring that point up again later when we talk about the reasons to screen, how it changes the lives of the family, the person upside down overnight. And if you don't have any preconceived notion that you might even be at risk, you can't even pronounce the word diabetes, you never heard of it, I think it's good to get educated if your loved one is at risk.
Absolutely.
So then I suppose, moving forward, so ultimately, I guess at some point you decide to have children. How was type 1 diabetes in your mind in terms of, risk for your children? Was that something you were always worried about, or what was your thought process there?
Yeah, well, I was worried about becoming pregnant with diabetes, and I never had a hemoglobin A1C that was safe for pregnancy. So it was something I wasn't sure that I'd be able to do, and so that was a real stress factor for me, and it made me wonder, can I do this? Should I do this? It's so dangerous. I knew all the complications that can happen and all that, and I was able to do it successfully. And I remember when my oldest was born, it sounds crazy, but the first thing that I thought when I saw him was it's like I said to myself, I did it. And I just thought, I never really knew that I could successfully bring a healthy child in this world. I was certain that my diabetes would have a negative impact on the developing baby. There's so much from prior to conception all the way through delivery that things can, there's more risk factors for moms with diabetes. And then I know statistically, I believe if a mother has type 1 diabetes, the child has about a 4% chance. That's what I've heard. So I thought in my head I could have probably like 25 kids before one of them would get diabetes. So it was never a concern of mine.
You'd have to switch to being a Mormon too.
Yeah, exactly. Yeah. So so my concern was, I just thought once the baby was delivered, I thought, and they had normal blood sugars after delivery, then the diabetes was no longer a concern for me in terms of, is it going to affect my children?
So you said you were always worried that your A1C wasn't safe for pregnancy, meaning you thought it was too high?
Correct.
And where were you in your training, or you completed your...
I had my first pregnancy when I was a fellow during my fellowship. Okay. Yeah.
I think that's so important that you're worried about your A1C, but you're a specialist in this area. You know a lot about it, and then
you know too much about it. Well, if you're pregnant yourself, and I'll just say for our listeners, back then, they want your A1C below 6.5, but you didn't have a continuous glucose monitor. You didn't have long-acting insulin, and you really did it in the dark ages, and so it must have been a tremendous amount of work.
Well, with my, you mean when I was a child?
No, when you were pregnant with your first.
Well, when I was pregnant, that was in 2016. So I was on the Medtronic 670G and their Guardian sensor, I believe. Yeah, their Guardian sensor. So I did have, I was on that system. Yeah.
I see.
Yeah. So but yeah, I think a recent episode, you used the time and tight range, like the 70 to 1. And that's kind of what it is for pregnancy. And,
right.
And I try to keep my A1C in the 5s, but I also, with my last pregnancy, I was on the Tandem and Dexcom, but I had to stop the Control IQ because you have overnight, the goal is 65 to 95. And with the Control IQ, the target's too high.
Yeah.
So, I remember being up in the middle of the night doing jumping jacks to get a 140 down, giving a micro bolus, so that's a lot of, it's a lot of work. I felt like all of my pregnancies, it was like having another full-time job or something.
Yeah, for sure.
Yeah.
Well, yeah, again, I think it's striking and good for our listeners to hear that, maybe you were quote unquote struggling with your diabetes, worried about your high A1C. And so many people are doing that. And I think it's a relief to people when Steve and I talk about, of course we have our highs and lows, and of course our A1Cs have been places that we didn't want them, that, that if you're struggling, you're certainly not alone. And then pregnancy on top of that, gosh, like you said, more than a full-time job. And the other important thing I think you said is that a lot of times people don't know the risk of kind of quote unquote passing on type 1 diabetes, or the risk for their kids. And you said about 4%, yeah, which is, about right. The way that I've always liked to think about it is there's a 95% chance they won't get type 1.
Yeah.
It's about a 10-fold higher risk for kids if they do have a parent with type 1, so there is an increased risk, but it's still overall quite low. So if you're listening to this, you have type 1, you're thinking about starting a family, I like to think that should not preclude people. And I have seen patients that have just assumed, I have type 1, if I have a kid, they're going to have it, so that information is super important.
Yeah, and the general population, type 1, is less than 1%.
Mm-hmm.
So 4% is a lot higher, but as Jeremy said, chances are much more your kid's not going to get it. But your family might be a little bit different.
Yes.
Because it definitely runs in your family, in your genes, and you've mentioned to me before we started that you have other family members that have type 1. So we do see clusters, and you're part of that cluster. But I would say nowadays you look at people with type 1, I mean, it's not a death sentence anymore. So we have to, us old fogies like Jeremy and I, we need to get that out of our minds. If our kids get diabetes, it's not the end of the world.
Far from it. And as we always say, that people with type 1 are living longer even than people without diabetes. So it's a good time to get it, I suppose. So all right, Emily, so ultimately now you have 4 kids. So walk us through the process of, again, your thought around, should I screen them for type 1? Should I just monitor them for symptoms? Like, what was your thinking there with the kiddos?
Yeah. Well, I guess I can start with my son Griffin's diagnosis. So this was in 2022. He was 1 year old, and I noticed there was 1 or 2 mornings in a week where he woke up and his diaper was overly saturated and his sleep sack and crib sheets were wet. And I didn't really think anything of it. And then it started to happen more frequently. And when it happened 3 mornings in a row, where there was the 3rd morning when I had to change his crib sheets and the diapers were the right size, I just said, well, I have a meter. Let me just prick him and just put my mind to rest that this isn't diabetes. And I did not think anything was going to be abnormal. So I pricked his toe, and his blood sugar was 200. And immediately I thought, well, this isn't a normal blood sugar, but this isn't like type 1 high. And then after lunch, I pricked him again, and it was in the high 300s. And so that was when I knew that he had diabetes.
Could I interrupt and say, what went through your mind when that happened?
So at first, I was trying to think, what else could it be? It's like I wasn't able to use my brain. I was just, this is something, maybe the meter's bad, or there's sugar in his toe. I was trying to come up with all kinds of explanations because I didn't believe it. But I remember my heart was pounding because I think I did know what it was. So that was really. It was obviously devastating to find out. And he was just the happiest, most energetic toddler. So he looked as well as he possibly could look. So it was really unbelievable for me. Yeah.
Yeah. I mean, I think a big fear, obviously, for parents. I mean, because I imagine that what's going through your head is, what it's like, to live with all of it, the injections and the lows and all that. So of course and maybe some guilt even, feeling about that. And,
absolutely.
I always talk about that. I think when my oldest was young, like 1 or 2, that I think I pricked his finger more than I did my own, because I was on a CGM, so I didn't really have to do it. But every time, he would, be a little bit more thirsty than usual or whatever, prick his toe or something. He hated it. He still hates it to this day. But knock on wood, he's been okay. But so then tell us a little bit about, managing his diabetes compared, I suppose, to yours, what that's been like, treating him and how he's responded to it, how he's doing. Kind of give us the update there.
Yeah. So it's, as you said, Jeremy, there is a lot of guilt and also it's, as you said, it's like you fear that you don't want your child to go through what you went through. And that's kind of how I felt like, to relive this through your child is just a horrible feeling. It's like your worst nightmare. It has been, I mean, it's, I guess there's a lot of, blessings, but it's also extremely challenging. So I will say that the one benefit is he has this technology, which is incredible. So he's on the T-Slim pump and the Dexcom with Control IQ, and it allows me to micromanage his diabetes from anywhere. He really could be in the care of anyone. They don't need to know anything about diabetes, and as long as they have his phone, glucose tablets, and his water, and then they're going to be able to answer their phone, I can micromanage his diabetes from anywhere. So that is a good thing.
Can I ask, when did he go on that? Was it like 1.5 or 2? Or?
Yeah, so he was 1.5 when he was diagnosed, and he started on the pump when he was about 6 weeks into his diagnosis. And I dilute his insulin, so he's on U25. Because the insulin has to be diluted in order for the pump settings to work.
He requires so little.
Exactly.
I'm just imagining this pump must be as big as his leg. I mean, like, you kind of like clip it to his diaper even?
He wears it in it's like a little fanny pack. Yeah. It's called a spy belt. And we have several of them. And so he just wears it around his waist. So, and they're all different colors and everything. So he's used to that. He doesn't mind that. And the site changes are still difficult, and the sensor changes are difficult. But the thing that, obviously is the most worrisome and the most difficult is when he's having highs and lows. And I know how bad that feels. Mm-hmm. And I hate that he has to go through that. Mm-hmm. It's, managing him, it's so much more difficult than managing my own for several reasons. I think one, because he's so small. If I make an error in calculating the grams of carbs he's eating, it can make a huge difference in his blood sugar. Whereas for me, if I'm plus or minus a few grams, it's not a big deal. I also can't always control what he does and what he eats. So, one day his favorite meal is mac and cheese, and the next day he throws his mac and cheese on the floor. And so it's difficult to know, well, how much insulin should I give for this? Mm-hmm. And, also like for me, I'll plan my exercise. But for him, sometimes he wants to run around in circles in the living room, and he's burning off all this energy. And I wasn't planning on him exercising, but
mm-hmm.
he's a toddler, so so that's really challenging. And then it's also just difficult to the goal A1C is less than 7% for all children of all ages. And I want to achieve that, but it's extremely difficult. You have to really micromanage everything he does and eats and sort of be a helicopter parent. And that's exhausting. There's times when I just want to throw my cell phone in the lake because it's just too much. You get data every 5 minutes, and he's at preschool. His teachers have to communicate with me all the time about everything. So that's exhausting. And that's something that, for example, my parents didn't do when I was diagnosed. Yeah.
Do you think you treat your daughters, your non-diabetic kids, different? You don't give them enough attention? Do they complain that they don't get enough attention? There's no sweets in the house because you got them all locked up?
No, they don't. I think that they are very happy that they don't have diabetes most of the time. They see Griffin crying when I have to change his side, and he's scared of the needle and all of that. But I think the only time that I think they do feel that Griffin gets more attention is when we go to diabetes camp, and most of the children there have diabetes, and we went to the diabetes camp gala, and they gave everyone with diabetes a gold medal, and my other children wanted a gold medal. And we do the JDRF walk, and there's then if you have diabetes, you get to wear a cape and be in the T1D Warrior Parade. So when we do things like that, where things are centered around diabetes, they see Griffin gets this attention. But I think at home,
Well, yeah, let the kid get a freaking medal. You know?
Yeah,
Like,
exactly.
You know what?
Yeah.
It's a great suggestion for the folks that organize those things. Give everyone a medal.
No, I would say no, not everyone. Just the type 1
I didn't
person.
say the same type. Maybe a
Silver
sibling
medal, yeah.
Yeah.
Okay, so you have 4 kids now.
Yes.
So it's 7, 5, 3. Griffin's 3 now. And then your youngest is just 3 months old.
Yes.
So when Griffin gets type 1, he's a year and a half. And then what did that do in terms of screening the other kids? How did that happen?
So when he got it, I felt guilty for a lot of reasons, but one of them is I thought, should I have known sooner? I actually don't think he was old enough to be screened or anyways.
He was very young.
He was very young. Yeah. And I thought, well, should I screen my other 2 children? And at the time they were age 3 and 5. And I didn't want to know. I just thought this is just going to cause anxiety. So I just kind of had it in the back of my mind, but didn't do anything about it. And I actually when I was at the Pediatric Endocrine Society meeting a year ago, I ran into Dr. Steve Gittleman, who was a mentor of mine at medical school, and I mentioned to him about Griffin and that I was debating about whether to put the other 2 through TrialNet because he's the principal investigator of TrialNet at UCSF where I was in medical school. And he told me that they're about to open up another study, the Petite study, for children age 0 to 7 to receive teplizumab, which has been FDA approved for age 8 and older. So he said you should screen them. And so I screened them, and my oldest, Lincoln, who was 6 at the time, was found to have 4 out of 5 positive antibodies. So he's considered to be stage 1 type 1 diabetes. And he's now being monitored with frequent hemoglobin A1Cs and oral glucose tolerance test. And then once he progresses to stage 2, then he could be eligible to receive teplizumab. If he's still 7, he could receive it through the Petite trial, which is a clinical study. But if he progresses at 8 or older, then it would.
So definitely a lot to unpack there. So first of all, do you remember how you got them screened? Did you go to your doctor, or how did you do that?
So I actually, so Dr. Gittleman, who I know, I just told him that I wanted to screen him, and I did it through UCSF. They just mailed me the kits, and I brought him to Quest. So you can do it by pricking your finger at home, or you can do it by a lab draw. And I just thought I'd rather the phlebotomist be the bad guy here. So I took my 2 children to Quest and got the blood drawn there, and then they send it to the TrialNet to get the result.
Well, if the card was positive, he would have had the blood draw needed anyway, so you saved him the finger prick.
We always talk about, just again for listeners, different ways to get people screened. And I think the best website right now is one that's called asktheexperts.org. And it's a website created by people at the Barbara Davis Center in Colorado, which is a leader in type 1 diabetes, really. And on that website, it has the different options for how to get screened. You can have a doctor order it and do it, an actual blood draw. Or there are different resources where people can send kits where you do a finger prick at home. So this is a website you can send to your brother, your sister, have your do this for your kids. They can do it for mom and dad. Really, you can do it kind of for any age. So it's an important resource to know about.
And just to add a little bit, you said that he's in stage 1, and just for our listeners, stage 1 is you have these antibodies that pretty much predict you're going to get type 1 eventually, but your blood sugars are completely normal. And then stage 2 is when the blood sugars are not in the diabetic range, but they're slightly abnormal, and those folks are candidates for the teplizumab, as you mentioned, the Tzield. So that's why you're monitoring him closely to see when he gets in that category. And I know you told me before we started that, if he can get in that study and he transitions to stage 2, you're going to go up there and stay in a hotel for a few weeks so he can get the therapy and how, the therapy, maybe with description of how that therapy goes for listeners.
Those stages are, really, they're important. And what teplizumab is approved for is, again, in stage 2, you have at least 2 of these antibodies that come back positive. You have some abnormal blood sugars. It's an IV medication that you have to get once a day, about a 30-minute infusion or so, once a day for 14 days in a row. And it's been shown in the clinical trials that people that got that medication versus placebo were able to delay the onset of type 1 diabetes on average by about 3 years. So not a cure, didn't completely prevent it, but man, 3 years is a lot of time, especially in the life of a kid, in terms of delaying this as long as possible. So if I can kind of paraphrase, I think, Emily, what you're saying is that your oldest is in stage 1 right now. So has been identified as being at higher risk of getting type 1 at some point. But this drug isn't approved until he gets some abnormal blood sugars, which he doesn't have yet. So not to put words in your mouth, but you're in a little bit of limbo that you have this information where you know that this could happen at some point and you want to intervene, but technically you can't quite yet because he doesn't, I suppose, thankfully doesn't meet the criteria because his blood sugars are normal. So where does that put you? Are you hoping that his blood sugars get a little abnormal so you can get him the medication or what?
Yeah, no, that's a good question because as I was saying to Eric, it's just so far it's just caused a lot of anxiety. And anytime that he wets the bed or I'm pricking his finger, I even put a sensor on him once. But yeah, I'm hoping that he stays in stage 1 for as long as possible. And I mean, the idea is how long can we delay this? And then when he goes into stage 2, I'm hoping we can pick that up as soon as possible, that he can receive teplizumab. And as you said, it can delay the onset for a few years. What I'm hoping then is there's a lot of other therapies on the horizon that are being investigated to also delay. So, maybe if teplizumab can delay him a few years, there's going to be something else that he'll be eligible for, and we can keep prolonging the window. That's my hope.
Yeah, in the teplizumab study, some patients never got diabetes to this day, and others got it earlier than 3 years. So it's, we don't know that much about the different types of type 1. Why do you have it so strongly in your family? There's a lot of unknowns out there. So, we can only hope, and I'm sure he's going to do fine if and when he ever gets it. Well, he's surrounded by too many good support people like yourself.
I'm just remembering when, teplizumab went to get approved by the FDA, I testified at the FDA. I don't know if you did too, Steve.
Yeah.
And it was, a big question to this FDA panel was, well, how big of a deal is a 3-year delay in type 1 diabetes? And it was myself and Steve and a few others. Like, that's a big deal. Because like you said, 8 is very different than 11, but also, all the systems that the three of us are on right now didn't exist 3 years ago. So the advancements in technology, all these kinds of things is huge. And then we build on it. We're not done with teplizumab. The next studies will be teplizumab plus something else. And hopefully that we can expand that. So 3 years becomes 5, becomes 10, you never get it. But right now where we're at is that screening is so important because, as we've talked about before, it's a little bit logistically difficult, right? Like if you came in to see me as a patient for type 1 diabetes, the ship sailed for you and me and Steve. It's about screening your family members and how do you disseminate that information to people that aren't necessarily your patients. And that's where it really falls on our listeners to educate their family members, to decide if they want to get screened or not, to go to these websites and really be proactive if they choose to know that information. Some people might say, I just don't want to know. And that's completely fine. As long as they know, what some of the benefits are, that the medications are available, kind of, et cetera. So right now you're kind of in a holding pattern with your oldest. Do you want to talk about the other two at all, or?
Sure. So Gloria, my 5-year-old, so she has 0 antibodies, but I do plan on having her screened probably about once a year, just because I want to monitor her. I now want to know about the antibody status. And then my little one, Hope, who's 3 months old, I obviously haven't screened her. She's not old enough. She had to go to the NICU when she was born, the neonatal intensive care unit, due to low blood sugars. And that also is due to my diabetes. So that was really stressful at the time. She's doing very well now. But yeah, that was...
Well, like you said, for healthy kids, I mean, nobody wants their kid to go to the NICU for a little bit, but otherwise doing well. I mean, that's kudos to you for going through that 4 times.
Yeah.
Yeah.
And you know what? And as a mother, you want your baby to be healthy. And that's for us adult endocrinologists. When our female patients get pregnant, they're golden, because they're usually fighting for good control. Mm-hmm. Trying to keep them in good control once they deliver is another story. Yeah. But you've had a lot of stress. You're stressed, the NICU. You're worrying about your kids. Anytime your kid wets his pants or diaper, I mean, how do you deal with that? Do you see someone? Does someone help you, like a clinical psychologist, for example?
I don't see anyone like a professional like that. I do have a lot of really good friends and family support, and yeah, it is a lot of stress. It's also just been so rewarding. I mean, I know you guys have kids too. It's just been the best thing I've ever done was have children. And, I don't want to, I love every minute of it. It's hard. It's very stressful. But it's also just so rewarding. I mean, they just bring so much joy, and I love spending time with them. So we do fun things, and I like to get exercise and try to get sleep, and every now and then when I can, take a nap. So yeah, it's busy, but it's good too. I wouldn't trade it for anything. So
I wanted to mention one quick thing as we get to the end of our podcast. You didn't mention your hubby at all. Does he get any kudos, or maybe if he listens to this, you don't want to slam him too hard?
Yeah. So he's a great husband and father. The whole diabetes thing is new to him. Although interestingly, his cousin was diagnosed a year and a day before our son Griffin. Oh, wow. So yeah, and I also have my first cousin was diagnosed when she was 4. So it is interesting that we do, for my kids, they have multiple first and second degree family members on both sides, maternal and paternal sides, with diabetes. So that's kind of interesting. But yeah, my husband, he enjoys going to diabetes camp and participating in the other diabetes related events that we do. And he tries to learn as much as possible. It has fallen almost completely on my plate in terms of managing Griffin's diabetes, but he likes to learn and participate as much as he can. So,
well, I'm thinking that we talked about obviously the negatives for poor Griffin, the highs and lows, changing needles, but there must be some positive in terms of bonding with him over this, I imagine. Yeah. And that probably will become more as he gets older and kind of can communicate. But is there a special bond there with him, or, it's beyond sympathy, but really like a bond?
Yes, no, absolutely. I definitely think that I have an incredibly strong bond with him. And I think in part it is due to the diabetes and just feeling like, my child is going through something that I went through as a child. Mm-hmm. And knowing when he's low, I feel like I'm low. When he's high, I feel like I'm high. It's like I don't feel good when he's high or low, because I'm just feeling it for him in a way. And I also guess I feel like he maybe more strongly has my genetics. I don't know, but I just feel like this incredible bond for that reason.
Well, I always say that Jeremy is my blood brother, and when he's high, I ask him to share.
Yeah.
Well, any concluding thoughts, or obviously, like, we just went through your life story in 30 minutes or so, but kind of maybe things you want to leave listeners with, whether that's things about screening or treatment, or just words of hope, encouragement, anything you want to say?
Yeah, absolutely. I think that diabetes is an incredibly challenging condition for anyone to manage. You cannot overestimate the emotional burden and the responsibility to be a parent of someone with diabetes or to have diabetes. I also think that it is incredible, like we've talked about, how far we've come over the past few decades that we've had diabetes, even over the past, like one of you mentioned, even the past few years, like 3 years ago, and it's exciting to see what's on the horizon. I really believe that in my lifetime, it's going to be I don't know about a cure or, the technology, but I think it's going to be almost like it's no big deal. And so it's sort of exciting to live through this and to kind of be part of this and to see where we're going and what's out there. So yeah, I think there's a lot of hope. And as you said, diabetes is not, I think he says, it's not a death sentence. Kids do great. They're resilient, they thrive. And there's a lot of people with diabetes. And I think being part of the diabetes community is one of the silver linings of having diabetes, making those connections and relationships, and kind of getting to go through it together. So I do think it is an opportunity, when you have diabetes to kind of be part of this world is very unique.
And it certainly shaped all of our careers as well. So, for me, that's a silver lining.
Yeah, for sure. I'd say well said. A lot of times I say, when I'm feeling good about things, that type 1 diabetes is the best thing that ever happened to me. And that it's kind of true. Certainly we wouldn't be sitting here. I wouldn't know Steve, and by extension you, Eric, who doesn't have diabetes, but we'll let him totally listen. So there are some positives for sure. A sense of empathy, going into medicine. I don't think it's always that the three of us went into medicine just because we want to do diabetes. There's a lot of people with type 1 that go into other things. I think there's a source of empathy and just wanting, health becomes something we focus on. So there certainly are a lot of positives, and I couldn't agree more in terms of what you said about how quickly things are changing. You and I haven't been diagnosed that long, and to go from finger pricks and 2 injections a day to continuous glucose monitors and these pumps that are just almost on a weekly basis seem to getting better and better. Things are improving.
Yeah, and of course, I was peeing in a test tube. Won't go back that far. Jeremy starts making fun of me. I had bamboo needles and stuff like that. But yeah, I think we're all fortunate.
Yeah.
Thank you, Emily.
Yeah, thank you so much for joining us. I'm sure our listeners really appreciate it. I know we did. And thanks for listening, and hope to have you on the next one. Please follow us, share, do all those social media things that you do. We appreciate it. And we'll talk to you all soon.
Emily, thank you so much.
Thank you so much for having me.